The South African Health Products Regulatory Authority has sounded the alarm over an increase of counterfeit weight loss products, particularly a fake Ozempic. These illicit substances are being peddled through various channels, including websites and social media platforms. Let's now bring in the SAHPRA Chief Regulatory Officer, Deon Puven, at SAHPRA to delve deeper into the dangers of these counterfeit medications and in the measures being taken to safeguard the public health. Deon, a very good morning to you. Thank you so much for making time for us. And of course, we're having this conversation as well as the world is marking World Diabetes Day. Since the advent of Ozempic and related products being used for weight loss, what has the impact of that been on the treatment that is required for people who actually need these life-saving drugs, who are diabetic?
Sure. So good morning to you and all the viewers. So the impact since the release or registration availability of the Ozempic has been because the public knows or they are aware, and as well as other healthcare professionals, that the semaglutide included in Ozempic can also be used for weight management, although not registered in South Africa for weight management. There has been an increase in the off-label prescribing by doctors of Ozempic, which has led to a shortage. The shortage has not only been caused by off-label use, it's also being caused by global demand for the Ozempic, which has been mentioned by the owners of the product, Novo Nordisk.
Yeah, and then the impact on that for health facilities to ensure that there is enough. What has that impact been specifically for South Africans?
So there has been an impact in terms of having product available for those that are taking it for type 2 diabetes. But we must also keep in mind that there are other type 2 diabetes medications that are available on the South African market. So those that have found it difficult to find stock have been encouraged to seek further advice from their doctors to prescribe type 2 diabetes medication alternatives.
Yeah. And then let's speak about what has happened now with the increase in the number of counterfeit or fake products that are being sold as Ozempic or do have some of the chemicals that you're referring to that people use for weight loss. What is it that your investigation has revealed so far?
So our investigations have brought up three concerns, which we have summarized in our press release. Our first concern is the proliferation of compounded medicines containing GLP-1. And our concern here is that these medicines might be substandard for various reasons. We don't know whether the compounders are actually putting in the exact active ingredient into the medication, which is required by law. It must be the same as that is in a registered medicine. Our investigations have also revealed that there are numerous places, especially online, that are selling versions of the Ozempic or the Mounjaro products that are registered in South Africa for type 2 diabetes, but they are selling these versions. And what our concern is that these versions are unauthorized, and some of them are actually falsified versions of the registered Ozempic and Mounjaro. And our concern here is unauthorized medicines have not been evaluated by SAHPRA for safety, quality, and efficacy. So as the public, there is no assurance that these medicines will actually work or that they can actually do more harm to you than good.
Yeah, on the press release that you shared with us, there are a number of websites that are listed here, and I'm going to read them out. Just juiceheads.co.za, anabolicsza.com, and then you also have sallyslimming.co.za, slimandburn.co.za, and www.researchpeptides.co.za. What is it that you found on these particular websites? And as per your investigation, has any charges been brought against these organizations?
Yeah, so what we found is that they are selling versions of medicines that contain semaglutide or tirzepatide or other GLP-1 agonists of products that are registered in South Africa, but these are unauthorized versions. Now, in terms of the Medicines Act, if a substance is registrable, and semaglutide and tirzepatide are registrable substances in South Africa, that product must be registered. If it is not registered, it's a contravention of the Medicines Act, and it is a prosecutable offense.
Yeah.
With internet sites, and this is a global phenomenon, it's very difficult sometimes to track the hosts of internet sites. Where we have tracked them down and we have done enforcement, we have regulated them such that they stop selling it. But there are also some websites where we cannot trace the host and we cannot then enforce. We cannot then further prosecute. So that is why we are also informing the public to say that if you are looking at this website and they are selling these medicines, do not purchase them. And we are working with law enforcement, various agencies with law enforcement, in order to actually tackle the scourge of these internet sites selling unauthorized medicines. But obviously that is ongoing. In the meantime, we are informing the public, do not buy from here. Buy from legitimate sources. And if it's a registrable prescription medicine, get a prescription from your doctor.
Yeah, but why is it difficult to track down the suppliers of these counterfeit goods? Because here's the thing, is that we are speaking here about a product. It's medication. It's a product. It needs to be delivered at a particular address. It has a destination, which means that it comes from somewhere. And surely if you follow the supply chain flow, it will get you to who the person is who dispersed or dispatched these medications.
Yes. So, I mean, Aldrin, these are criminal elements. They are going to cover the tracks. And with internet sales, this is one of the difficulties that law enforcement and regulatory bodies face across the world, is that they are able to cover the tracks. They are able to make their websites available for viewing by the public in various countries. But to trace them actually requires a little bit of work. And sometimes these sites are untraceable. Sometimes these sites are sitting in countries where we don't have any cooperation agreement. We are not able to get the country where the site is hosted to close the site down. Now, these are all challenges that we face and that we are actually investigating, and we're collaborating even with agencies like Interpol. But these things take time. Therefore, in the meantime, we're urging the public, when you see these sites that SAHPRA or any other agency in the world has not been able to take down or been able to trace where the source of the product is coming from, do not consume these products.
Yeah. Tell us about the Business Day had a report, I think about 2 days ago, of Aspen Pharmacare, which has a distribution agreement with the suppliers of Monjaro. And from this article, it says that SAHPRA was currently reviewing an application for it to be used for chronic weight management. Is that the case? And what goes into reviewing medication of this nature?
So as the regulator, we cannot comment on what applications are sitting with us because we are bound by the secrecy law or the secrecy section in our Medicines Act. So if the company has commented to Business Day, that is their comment. However, I can explain to you very briefly that when we review a product for registration, we look at how it's made, we look at the clinical evidence behind it, and we also look at where it's made, because those are very important aspects. And I'm talking very, very paraphrased here, what we do. Those are important aspects to determine the quality, safety, and efficacy. Another thing that we do as the regulator to ensure that the product that gets to the end user is a quality product is regulate the supply chain. We license the manufacturers, the importers of the medicines, as well as the wholesalers where they sell those medicines to. And those wholesalers then sell to licensed dispensaries or pharmacies who are then able to dispense the product directly to the market.
Okay, Dion, I'm going to try again on this one without mentioning any names. Are you able to confirm whether any applications have been brought to SAHPRA to have medication that is being used to treat diabetes, to also have that medication being used for weight management?
Yes, I can confirm that we do have applications in the system of GLP-1 agonists that are currently in registration for weight loss. I must also mention that South Africa does have currently registered GLP-1 agonists for weight loss indications.
Okay, then. Thank you so much for that.